We're here live in New York City at the LifeMod headquarters. I'm here with Dr. Gonzalez, founder of LifeMod, creator of LifeMod. And today I'm going to talk about something that I've always found interesting. As someone that was really into exercising and working out and keeping fit, I'm going to be 31 now. And I realized over the last couple of years, I'm telling you, over the last couple of years, things have not, I don't have the strength that I did. I get tired quicker. I feel like some days I just have brain fog. And we did my blood work, and we saw that I was a little low in testosterone. And we started, I went on testosterone to replenish that, I guess, to bring my levels up. And it's been about 2 weeks. And I have to tell you, it's unbelievable.
Yeah.
In just 2 days, I started noticing a difference. I had more energy. The first thing I noticed, surprisingly, was that my skin tightened. I don't know if that's something that's normal. I don't know if it was a placebo effect because I knew I was going on it, but I noticed that my skin tightened. I showed you a before and after. I'm not going to show it here on the show.
Why not?
I think
camera's right there.
The camera's right there. I could show it. Maybe I'll. You know what? Maybe I'll add it later on, or
Sure.
I'll add it to the website, the LifeMod website. But you saw a tremendous difference in 2 weeks.
Yep.
So I want to talk about this and how the pros and cons of going on testosterone, the right way people are doing it, the wrong way people are doing it. My wife knows that I'm on this, and she was asking me, well, is this synthetic?
Right.
How does this going to affect you later on in life? So I want you to go ahead and tell us a little bit about how you do testosterone therapy and hormone therapy in general, hormone replenishment in general.
Right. So LifeMod is actually very big on bioidentical hormone replacement. And
what does that mean
and
exactly?
I'm gonna go back a little bit and try to explain it. There's a big difference between bioidentical hormone replacement and the synthetic hormone replacement. When we talk about hormones, I just want the viewership to understand that there's two things that we're talking about. We're talking about hormones that are like sex hormones, i.e. testosterone, estrogen, progesterone, all those sort of sexual hormones that, as you know, most people think of hormones for women are estrogen and progesterone, and the hormones for men are the testosterone or the DHEA. But there's all sorts of hormones. I mean, thyroid hormone is one. The TSH is a thyroid stimulating hormone. So there, vitamin D. I mean, there's a lot of vitamins which are classified as hormones. So really, hormones, the word hormones is a huge sort of encompasses a lot of things underneath that word. For today's sort of topic, we're talking about bioidentical hormones and sexual hormones mainly. And the difference between bioidentical and synthetic hormone is that in a bioidentical hormone, you're looking at hormones that are created from a natural substance. They're bioidentical. They are identical to your normal testosterone or your normal estrogen or your normal progesterone.
So that's what you are administrating here.
That's right.
At LifeMod. A synthetic, let's say, version of this would be what? Illegal steroids that you think of when you think of going to the gym.
Sure,
and someone is selling it.
There is also medical synthetic hormones. For example, somebody who's very, very deficient in testosterone, traditionally, if you went to an endocrinologist or a family physician or an internist, you would get a prescription for a synthetic testosterone, like testosterone cypionate. You know, for one example, there's lots of them out there. But these are hormones that are made in the lab. They're not bioidentical. They're not made from natural substances. They're mostly made from a synthetic compound in the lab. And the problem is, as you've probably have heard a lot in the news, I certainly love the whole concept of the attorney, commercials where, if you've been given testosterone by your doctor and now you have cancer, call us, you're entitled to millions of dollars. One of the things that we've tried to shy away from in LifeMod is to just always give synthetic hormones, because obviously bioidentical, which are made mostly from yams and sweet potatoes, same thing, I guess, another show between sweet potatoes and yams, and how testosterone or estrogen made from yams or potatoes, sweet potatoes, is different from the other synthetic hormone. However, I'll tell you, let me go back a little bit. Anti-aging medicine and functional medicine, which is what I am and what we do, apart from being an orthopedist and a sports medicine doctor, the whole premise of LifeMod is life extension, and study after study after study has shown that the reason people age from one year to the other, especially when you get into, as a male, Andrew, you were saying you're 31, you're still young though, but as we get older, your testosterone levels, our hormone levels start to decrease, and they decrease by a big factor, like 2 or 3 times every single year.
Sure, and depending on your age, there are the normal level will change for you. The normal level for a 19-year-old is very different than a 30-year-old, and very different from a 40-year-old.
Correct.
So you go based on that.
Right.
When you're not giving testosterone to replenish like a 40-year-old to be the same as a 19-year-old.
Right. Yes and no. Okay. And that's a very good question, because, the theory behind, the concept behind anti-aging medicine is that why should we live with a low hormone level? I mean, why should we accept that as natural aging? That's the problem with, how we've accepted aging in this country. We just get older and your testosterone level's lower. But what we try to do is supplant it to a normal level for your age group if you have it lower. But there are people who have a normal testosterone for a 40-year-old that still, comes here and has symptoms of fatigue and low sexual energy and, low muscle mass. And there's nothing wrong with trying to give them testosterone to bring them to, let's say, a 20-year-old.
When you see a case like that, where you see a 42-year-old that, his levels seem fine for the age, but he is experiencing the side effects of someone that does have low testosterone, does that mean generally that they had much higher testosterone than the norm at a younger age?
It could be that. I mean, it could be not as well, but that's a good sort of way of thinking about that. So that if and then at that point we have to sit down with the patient. Look, I don't ever tell my members you have to do this. I never give them something that they don't need or they don't want.
Sure.
However, because I'm an anti-aging functional medicine doctor, there is nothing wrong actually with trying to get them to a younger age and from a hormone level standpoint. And you have to remember, Andrew. Your sort of not the perception, but your reaction to the hormone that we gave you, right? The way you felt was actually pretty impressive.
I'm telling you right now, and I'm not saying it to sell something. It tremendously improved my day-to-day life.
Yep.
No depression. I was speaking to one of your colleagues today. She's here right in the studio.
Nice.
I didn't want to know if you wanted to mention her name.
Sure, why not?
I was speaking to Rosanna, and she was asking me, how do you feel on it? And I go, it's almost like euphoric.
Right.
Right? The first couple, now it's leveled off, but initially I had this euphoric reaction to it where I felt great. I felt energized. I was doing longer workouts, which I couldn't get past 20 minutes. Now I'm doing about 35 minutes a day, which isn't a crazy improvement, but it's still 15 minutes more a day.
Absolutely.
Just my overall mood is I'm able to deal with situations that I normally would get frantic or frazzled with. I'm able to deal with it pretty level-headed. So I'm always coasting.
Right.
You're always... I don't have the word exactly to describe it, and that just shows you how new this is to me. I'm level-headed.
Right.
Most of the time. I won't react.
You were also talking about how you were a lot more focused, and there was that focus of energy.
I call it brain fog.
Yeah, gone,
right?
Some
days, if I don't have enough coffee or if I'm tired, I will not be able to. I will sit here and I'm typing up an email, and I can't put the words together in an email because I send 50 emails a day. And I notice around 1, 2 o'clock, I'm burnt out at that point. I can't figure out the introductory sentence.
Right.
And that's a problem in my business.
Right.
As soon as I went on this, within a couple days, I noticed I'm able to react quicker. I'm able to get the words out in a articulate way.
Right.
Forget about the working out, which I know a lot of people focus around that, and when they think of testosterone, they think of, well, I'm gonna take testosterone, I'm gonna get muscle. Yeah, I mean, if you work out, you will get muscle. Your metabolism will speed up a little bit, but just in my day-to-day business, I've seen a tremendous improvement.
Right, absolutely. And you look like you've been gotten a little bit more cut.
I haven't.
Actually.
I'm probably today. I'm 165 pounds or 166 pounds. It's after lunch. But
by the way, for those of you out there, we're actually going to put him on the InBody machine.
Yeah, right
afterwards.
after this, we're going to go on the machine, which I did take the machine I did go on the machine the first day we recorded, and I was very disappointed by it.
I remember.
I was very disappointed. It actually depressed me a little bit. So today we're going to go on it again, and we'll
next
give you an
show
update
we'll
for
give
the
you an
next
update.
show.
Yeah, absolutely.
And I'm curious to see, after 2 weeks of being on this, has it changed anything?
Right.
Is it all in my head? I mean, it's possible that it is. It's possible that I'm working out a
There's
little bit harder.
certainly a little bit of a placebo effect for sure, but I want to go back a little bit and talk about why we even use hormone replacement in the first place. And this goes for women as well. Right now we're talking about
next question.
Yeah. So there's hormone replacement for women as well, and as you know, obviously as women age, their estrogen levels also decrease. You have to remember, women also have a fair amount of testosterone. I mean, not as much as you and I have, Andrew, but they definitely have testosterone, and so as women age as well, that also decreases.
To kind of put this into perspective. And I know we're going to generalize, and we don't like generalizing here at LifeMod.
Never.
But if we were
Very
to generalize, what would be...
Ro is our audience today, and she's
smiling.
She's smiling.
What would we say is the average testosterone level for a 30-year-old man, and what would it be for a woman, to kind of put into comparison,
right.
Because obviously women have much less testosterone than men, just so we understand
Sure.
what it's like.
Yeah, so numbers are sort of dependent on age, and they're also dependent on what testosterone you're measuring. Because the two testosterone levels that really I care about is free testosterone and then bound and serum testosterone. The serum testosterone and the bound testosterone is the measurement of the number of testosterone level that is in your blood, and that goes for females and males.
Okay.
For a 30-year-old male, that free testosterone range should be between 400 and 800. For a woman, you're looking at a testosterone level of like 5 to 30. That's mostly generally those are the norms. Free testosterone is the amount of testosterone that we measure that's in your blood that's ready to be bound. In other words, it's flowing around your system, and it's ready to be used and utilized, and it's supposed to bind to something. That's what we call free testosterone. In other words, if you think about free testosterone as a testosterone that's available for usage. For a 30-year-old male, you want to be a good number of like between 30 and 100 of free testosterone. That's in the upper limit. 100's a lot. It's kind of high, but for a female, that should not be that high. It should be around 5.
It should be around 5
yeah.
for a female.
But let's go a little bit behind, kind of a little bit behind the cue ball here, and talk about why we do hormone replacement. If you look at the American culture since the 1950s, there has been a consistent reduction in levels of testosterone in men.
Okay.
And we can do another segment on this because this could last an hour and a half. There's been a lot of theories as to why men's testosterone levels have decreased so much. Think about this, though. My father, for those of you who don't know, is Mexican, and he's in his young 80s. I don't know what his testosterone level is. They live out in New Mexico, but I would love to be able to test it, because I guarantee you his testosterone level is probably higher than mine.
Okay, so what would cause that? That's great. I mean, that's amazing to hear, and we've heard this. Is it? I'm sure it's a combination of many things. It's a combination of work that we do nowadays. It's a combination of our diet,
right?
What kind of food we're eating. So tell me exactly what would cause that, to see such a giant gap between, let's say 50 years ago and today.
Sure. So it's definitely multifactorial, like you said, for sure. But if you look at my father from age, 5 to 18, he was working on the field. He had a hoe and a shovel in his hand. He was plowing the land. He was out doing physical work. Now, those are the years, what we call the formative years, right? So as a man, for example, between 14, 15, 16, 17, 18, is when you have the highest testosterone. You're building the most muscle. Remember that one of the natural ways to get your natural testosterone higher is to actually get more muscle. So the more you lift, the more muscle you have, the more testosterone you produce. The more testosterone you have, the bigger weight you can lift. So the bigger weight you can lift, the bigger muscle you have. That's sort of the concept, right? So if you think about these men a long time ago who really worked the land, who were physical and laboring and laborers and hunters, this is why testosterone levels were that high, because they had a lot of muscle. They were producing testosterone. You and I, different generation.
Very different.
I did work the land a little bit, but I'm not working the land now.
Yeah.
And so, now we get our testosterone, our muscle sort of from a artificial way of just going to the gym and lifting now. Completely different.
Very different.
Than
yeah.
using the dynamic of tilling the land.
Yeah.
Completely different. So muscle groups were definitely bigger, I think, then. They were more in line with the what we call the human design, and we've talked about that many times. At LifeMod, we are big believers in that. And so, but anyway, that's a big reason. The second reason, and you said it was multifactorial, and this is a concept that LifeMod hasn't really adopted yet, but we're doing a lot of research. By the way, for those of you who are watching us, with LifeMod, I am a physician, I'm a medical doctor, and a lot of what I say is very controversial, and you know that.
Sure, yeah.
We've talked about a lot of controversial stuff. But I also have to remember that my Hippocratic Oath is always to help people, and that first do no harm, or primum non nocere, which is the Latin phrase of that. And I try to always temper what I say with science and with research. Unfortunately, because we're at the cutting edge of anti-aging medicine, there's not a lot of research to back up a lot of what I say in terms of a lot of research, and kind of research that a lot of the medical community would like to see. There is a couple of sort of dogmas out there about why testosterone levels have been lower in men nowadays, especially in big cities like New York, LA. They've tested this, and they've seen that since the 1950s, testosterone levels have continuously decreased for men. Two reasons for that they've proposed, and we're looking into this to see how real factual this is. One is that since the 1950s, women have been taking the birth control pill, so that when we're born, if our mothers were exposed to a lot more estrogen from a birth control standpoint, or just synthetic estrogen, we tend to have a little bit less testosterone than before, because women before never really were exposed to anything synthetic at all. It was all natural. That's one reason. There's another sort of dogma out there, and this was a little bit kind of crazy. The viewership is probably going to freak out a little bit on this, but there is some thought to this and some truth to this. Is that since women have been taking the estrogen pill, the birth control pill, for many years now, some of that parts per million estrogen has actually seeped into the drinking water system, and so that men nowadays have been exposed to more estrogen than they ever have from a natural standpoint. So whether or not that's true, certainly plausible, sort of thoughts to think about. Whatever it is, the truth is that men do have lower testosterone levels now. So why wouldn't it be okay to try to supplant that? And we think, as functional doctors and anti-aging doctors, Andrew, is that if we give you testosterone, and it's bioidentical, I'm hopefully not hurting you or causing any harm, which I wouldn't do it if I thought I was. One, but two, I'm also making you feel better. You have more energy.
Absolutely.
You get more muscle. And if you can create more natural muscle, that's going to give you more natural testosterone. What's bad in that?
So why? And I'm going to, obviously you can't answer this because you don't know what other doctors are thinking, but I'm going to present this to you. Why is it that many doctors are against doing testosterone or hormone replacement therapy? Is it because of the negative stigma that surrounds that, in the sense that, because when we think of testosterone, many people think of, the 1980s and 1990s way of doing it and who's using testosterone. Is that still a stigma in people's minds when, if I go to a doctor and I say, listen, I feel tired, I'm depressed, my sex drive is down, I really want to do something, and the doctor says, I'm sorry, I can't give you anything.
Right.
Why does that still exist now, when I could go to a doctor and say I banged my knee and they're going to give me an opiate?
Right. And that's a beautiful question, and I don't know why. I think this is why I've decided to take the track that I'm taking in terms of functional medicine and anti-aging medicine. Look, we all want to live longer. We all want to live younger longer. And so I think that the stigma of that is that if you were a doctor and you gave testosterone to somebody and try to supplant that you were really not a good doctor, because, the natural process should be let out and you should let it play out. And, if you're a doctor, you're just supposed to encourage and support that. And I don't believe in that. And that's why we're a big sort of controversial, amazing firm at LifeMod, I think, because we're saying, look, the studies are that there's nothing wrong with giving you testosterone if it's going to make you feel. I've always said this, and it's funny because I'm going to ask you a little bit. I'm going to actually interview you here in a little bit.
Please go ahead.
But before I do that, what is wrong with, and I've said this in LifeMod many times, last year, 2 years ago, I ran the New York City Marathon. And for those of you who are not in the Northeast region and are followers from all over, that year was the year coming off Hurricane Sandy. They had canceled the marathon that year. And I remember there was one death, but it was not a cardiac-related death for that marathon. It was an old lady. I don't, forgive me if I don't remember, it was 92 or 93 years old, Ro, you don't remember? 93, I think, yeah. She basically was running the marathon and tripped and hit her head on the pavement in New York City. I think she hit herself already in Manhattan. She was about to finish, and she ended up getting a bleed, I think it was a subarachnoid bleed or a subdural hematoma. I don't know what it was. Anyway, she ended up dying in her sleep 2 days later, and she
never went to a doctor.
She didn't go to the doctor. She was just tired, and she went to sleep and died. You know, that is how I want to go. You know, and I don't mean I want to be running the New York City Marathon. Maybe I do, but I want to die. When I die, I want to be able to be full capacity, full mental capacity, full functional physical capacity. And if I'm 80 as opposed to 110, and if I'm 110, the last 20 years I'm in a wheelchair, that's not how I want to go.
Yeah.
Now, and so that's, if I'm a doctor and I really want to help people, and I want to first do no harm, primum non nocere again, then why is it so bad to give something to somebody that they need anyway from a natural standpoint, and it making them feel good, and it's making them go out and be more active and live life to a fuller extent? That's where I'm coming from. You have to do it in an ethical way. Absolutely. I would never ever cross that line because I am a doctor, first of all. But you can't, to be able to just say, well, we don't know what the studies show, and I can't really give you testosterone or estrogen if you're a female because, I might be causing you harm, but we don't really know if you're really causing harm. Meanwhile, that person feels great on it. There's really nothing wrong with that, I don't think. So, and the reason I'm saying this is because when people are a little deficient in hormones, like you were in testosterone a little bit, and we gave you testosterone. Now I'm going to turn the thing around here, and I'm going to ask you a few questions. You came to us, and we found out that your testosterone level was low. You're 31. You're a good-looking guy. You're active. You've been doing a lot of stuff. You're married. You really didn't have any major complaints.
I didn't have not much.
No, and so one of the things that we said, okay, look, we sat you down, right? We said, look, your testosterone level is a little low. Why don't we try this bioidentical testosterone cream and see how you feel?
And we said if I don't feel well, and this is what you said. He goes, if you don't feel good on it, then you don't have to do it.
Right.
But at least give it a shot. See how you feel. If you feel good, then that's great.
Was it a consensual decision? Both you and I sat down and we said, okay, perfect. So we said, we both agreed, let's try it. Yeah. You tried it. You called me 3 days later and said, is this the placebo effect? Because I feel like great.
Yeah.
The answer
the first thing was, honestly, was that my skin tightened.
So let's talk about that. Your skin tightened.
Actually, why don't we do this? We have to take a break.
We do.
We have to take a little break because this is our first podcast.
Perfect.
Official podcast.
Nice. Okay.
We're going to take a little break.
Okay.
We're going to just regroup a little bit, and we're going to be right back after this.
Perfect.